you had a pretty interesting journey into how you got into becoming a naturopath, correct?
Yeah.
Because you were on TV.
I was in the television business. I had my own talk shows and I was an anchor and did that, but I was always interested in science. And then, long story short, family having some things, and I said, there's got to be a better way. I was always interested in surgery. Yeah. I said, if I was going to do an allopathic route, it would be surgery. That makes sense. When it's needed, right? Yeah. Otherwise, the chronic degenerative, we're failing. It's a miserable failure. But when I knew there was a license to do both, to be able to prescribe and look and do minor surgeries and these things, I said, okay, this is where I want to sit. So, and then I knew from day one, though, that I always wanted to get back to the public to be able to say, let me put this in terms you can hear.
Isn't that opposite, like allopathic and surgery? I know there's some, I don't know.
With naturopathic
time and place.
surgery you're talking.
Well, it's a bridge, Right. So it's a bridge of, it's good science and good medicine is good medicine. I don't care what type of physician you are, how you were trained, good medicine's good medicine and good science. There's a time and a place for surgery. There's time and a place for chemo. Naturopaths would say, no.
You're thinking differently. You're thinking holistic versus allopathic. So naturopathic isn't exactly holistic.
So let's describe, I think there's always this semantics that we all struggle with, right? Yeah. Holistic, people think of that as that homeopathy, and people say whatever that is, right? It's a whole system in itself. Holistic means you're looking at the whole person, the whole body, everything. You're not just a specialist looking at one section. You're looking at all of it. But naturopathic medical doctors, like in Arizona where I'm licensed, we're licensed in both systems of medicine. So we're trained to do minor surgery. We can prescribe medicine, so we're trained to think allopathically or conventional medicine. Look at the science, look at this, but we're also trained in, guess what's over here? Clinical nutrition, botanical medicines, Chinese medicine. We know we're licensed in these things and know this side so that we get to say, okay, let's look at the whole picture. It's not either or.
Yeah, it definitely isn't either or. Yeah. It's you have to combine them.
Yeah. But we lean more, when we can, toward natural first. Let's see if we can do something with diet and lifestyle as we were talking. Yeah. How much can you get there? But
I like to cut.
Well, I was known as the needle queen. I was doing Prolo and platelet before anybody was talking about it, right? So I like the procedures as well, but I don't do that anymore. I'm just working with my oncology patients.
Okay.
So
you don't do the injections there?
I don't anymore. I taught it. We did it for years. There's a group of us that taught this around the United States, and we taught enough of them. Most people know how to do it now. Yeah. Okay. Go do it. All right. No, I'm more education now.
Okay. All right. Cool.
Especially with oncology, with the metabolic therapies, hyperbaric, keto, the repurposed drugs.
Yeah. So one of my questions was, like, if you were to run a wellness center, what are your top, like, either you can call them biohacking, or what things should you have in a wellness clinic?
Yeah, if you look, everybody's got the same stuff going now, right? Everybody's doing the same IVs, same things that we as naturopaths have been doing a long time. Yeah. But it's great and trying to keep up with the latest and greatest. Yeah. My issue is that I think that if you're going to be on that gray area or something that's not quite there, become a research center, or at least be doing research on what you're doing, so you're collecting the data and you're keeping people safe. So that's my thing. I had a group, you guys probably know Dr. Paul Nassif from Botch. Yeah. Paul's a good friend. Yeah. He and the chair of Cedars-Sinai cardiology came to me and they said, this has been a few years ago, and they said, we need to do a longevity clinic. I said, well, first of all, let's call it Mito clinics, and I trademarked that because we're addressing the mitochondria. Yeah. So anything that addresses mitochondria. Yes. So that's your diet, your lifestyle, certain supplements. Yeah. Those are basics to me. Yeah. And then you got to address the stress, which I know nothing better than music. Yeah. But you got to talk to Barry about that in a minute to get people into a brain and heart entrainment where we can get that stress under control, because some of the most stressed people I know are the biohackers.
Oh, yeah.
I had one in my office today. You guys would love it. Fit guy. I mean, on it. Worries about
answers.
Oh yeah, more is better.
How to do better? But like, but it's like when I first started getting into it, and like, you read the different books, and I'm like, this just seems like too much. And
it's
then
too much.
It was too much, and you're like, all right, how? Like, as a surgeon, I don't have time to do
Right.
like any of
I think
that.
there's a different way for different people to enter that
Definitely.
mind state. And
I'm like,
where,
I'd rather
the
sleep
musical
than do a
thing-
3-hour morning routine.
And you
get
know,
that-
sleep's probably more
Yeah.
restorative and better
Yeah.
anyway.
Yeah.
So
Yeah,
And I was going to say music, it's never thought of as a biohack, but it's one of the oldest biohacks that we have.
Yes.
If you go back to Chinese medicine, even in the symbol of Chinese medicine, the symbol of music is within that.
Yeah.
unless it's Nickelback, then it's the opposite.
well, if it brings joy, that's healing
I'm
too.
kidding. we did. I actually did a sound session with my wife with the sound bowls.
Yeah.
One of the resorts here last weekend, and she was like, "Okay, if you don't want it to be too intense, have your head this way." I was like, "Oh no, I want my face right next to the bowls." It got so loud, and it was it's not too much for me. It's
You
like exactly what I want. She's like,
You probably
"What do you
like
want?"
standing
I
in
was
the
like,
front of the
last time I
subwoofers
did
too.
it, I fell into a trance, literally.
Yeah.
I fell into a trance, fell asleep, and like fell over. And I was like, I want everything I felt that last time. My wife's the complete opposite. It's like, I want to be propped up, and it would be nice to hear that. And it was still too loud for her with the bowls.
Everybody's
But I was
different.
just like, come on, get me into deeper trance. Let's
You
go.
probably like standing in front of the subwoofers at the club too.
kind of. It matters like how it makes you feel.
Right, exactly.
Like
and
when-
some people
when
want to
the-
feel it more than, and I think that's something that's not normally talked about, like within non-invasive type treatments, right? And biohacking within music and frequency and vibration. It's the same thing. Like, we're not talking about dosage. Each person is individual, and the dosage matters for it to take you to the place you want to go. You want to move into parasympathetic. You're going to have a different way that you receive the music than your wife does. So her dosage is going to be different than yours. But we don't talk about dosage within music.
Good light show along
Yeah.
with the vibration.
There you go.
So it varies different. This different sensory, like whether it's like visual or auditory or sensory. And I was just like, okay, this she wouldn't like this. I want this to be as an intense thing. Like, let me lay my head next to your sound bowl. And it's not really that loud if you have your eyes open. If you close your eyes, it's like, oh my God, this is the loudest thing.
Well,
in
yeah,
the world.
your brainwaves are slower. As soon as you slow your eyes, you're moving into an alpha state. So you're hearing things differently and receiving it in your body differently as well. And you're producing different hormones. If she's stressed out, right, she's going to be producing cortisol. If you're relaxed, you're going to be moving into producing less of that and possibly producing dopamine. So the emotional aspects have an effect on your physical pharmacy. And even going back to Nickelback, when you're talking, we're talking about Nickelback, here's something interesting though. So they did studies of people in psychosis, right? And they couldn't listen to relaxing music and slow their brainwaves down.
Too far apart.
Too far apart. They're in high beta brainwaves,
Agitated.
and they're trying to get them down to a slower brainwave state. So
Did
they
you
have
say
to.
he's in psychosis? That's why he
No, I
couldn't do
didn't
this?
say he's a psychosis.
But they
I think the
also,
not
Tylenol
yet.
was opposite, Mom. We got to
they
ask.
can't do that
We
with
can't
music.
listen
And they,
to Nickelback and all.
But it's preferred music, so it's
It's
their
true.
preferred music that took them
Yes.
out of that.
Yeah, I
And
have
more and
seen
more
that.
research on preferred music.
Yeah, preferred music rather than like certain types of
That's
music.
right.
Yeah, and in working out as well.
Yeah.
Same thing. They're showing recoveries is higher when you're listening to the music that you like, not just the music that's going on in your gym.
Club.
Yeah.
So
No more Nickelback.
Yeah. Well, I
Nobody
use what's the visor, the headpiece that
I don't know. You have so many fucking.
Brain Tap.
Brain tap. I was going to say.
I love
some of
Brain
his
Tap.
music
Brain
is on
Tap,
that.
Yeah,
Yeah,
Brain
I'm on
Tap
Brain
works
Tap.
great, and then I also got this new thing, Neurovisor, which plays a light show, and you it gets you into a trance. And seriously, it's like the stuff that they say is going to give you energy. It does give you energy, and you're like awake and like changes your whole thought process. And I always talk about it because I think it's a great way if you don't know how to meditate or have time for it. I think it's a great way to just kick your way in there.
Yeah,
trying to get those brain waves to change, though, watching it on EEGs, watching the science, the fastest way I've seen is with music.
Yeah.
It changes because everything else you have to think through.
Yeah.
Even your thinking, is this working out?
Yeah.
The music immediately takes you there.
Yeah.
So it's amazing because we are frequency beings. I mean, we know we all vibrate at different frequencies. We just are.
Yeah.
We're not just this physical bag that we see here, right?
So that's how we met. We actually met through
Physical
vibration,
bags?
frequency.
I was going to say, did we? I'm like, I don't remember that.
Through what?
Through
We were
physical
saying the
bags.
physical bags. We were talking
There
about
you go,
physical
yeah.
bags. Yeah,
Frequency
no.
dating. You should.
How'd you
Yeah.
guys meet?
Dating it.
Someone, you tell the story.
That's all right. I was just in an airport and I was talking about cold lasers. I used to teach a lot of frequency-based medicine.
Yeah.
Right. So I'm saying 16 hertz for muscle retraction. I was giving a protocol to somebody, and somebody heard me on the phone talking about frequency and hertz, and she said, "I've got to tell you about this musician because he opens up for Wayne Dyer. His music is used in hospitals. He's written a book, blah, blah, blah. And his music is being proven to be changing these frequencies and brain. And so anyway, that's how we met. Long story short,
She introduced me to
that gal introduced.
Denise,
And
and
a couple years later.
2 years later we met. And,
So what do you play?
so my main instrument started off as guitar, and actually I was a rock musician, hip hop, club music, New York City producer. So I was not expecting to move into this area. What if I say, the thousands of people every night sleep with Barry Goldstein, because it's true. Like, people are using my
Now
music
I'm
for
going to
sleep.
look for your
Yeah, I
stuff.
sleep with Barry Goldstein is my
Yeah,
campaign.
it's funny.
But
They do.
yeah,
It's good
literally,
sleep
I
music.
got burnt out in the music business.
Yeah.
And I said, how do I get back to falling back in love with music again? Did some research and found that targeting the heart at a relaxed state, which is about 60 beats per minute. And this was like almost 30 years ago now. They weren't really talking about heart entrainment or coherence back then.
Yeah.
And I said, what would happen if I just allowed myself to just take the journey, set my metronome like a DJ, because I worked with DJs, I know the beats per minute. I'll set it for 60 beats per minute, and didn't think anyone was going to listen to this type of music. The opposite of what I was doing, right? Which was you had to have a hook, a chorus, 3 minutes music, and people have to be able to hum it. It was like the opposite of that, and just started sharing it with friends and family initially, and just found a lot of people being able to use it in dentist's office, for parents in hospice, and that made me want to research it more. Of like, okay, I know it's working, but why is it working?
Yeah.
And we now know that when you move into these smooth and orderly heart rhythms, when you're in training, so you have a physical metronome, which is our heart, obviously. It adapts to the tempo of the music, just like when you work out, you listen to faster music. When you want to relax, you listen to slower music. This is called entrainment. And when you move into those smooth and orderly rhythms, we now know as well that your brain waves start slowing down in conjunction. So there's a relationship between heart coherence and brain coherence. And it's becoming much more exciting in terms of a new field that's called neurocardiology, where they're linking the two together and knowing they affect each other. And I think that's really the next step of where it's going in my world. Because also in that longevity and biohacking community, we're also looking for like panaceas, and this is going to fix this. This is going to fix that.
Or thing on biohacking the brain.
Or even help.
Yeah.
But again, it is individualized medicine. It's not just use this frequency for that, use for that. There's a lot more than that. And it's geared towards your preferences, specific tempos, specific harmonics. It all kind of has to happen.
Specific tones, beats. There's people are going to respond
all
to
of
different
it.
things. And there's some ways, like even a Lady C person will respond to a certain beat a certain way that like another person wouldn't.
Do you think some of these DJs just have like, I don't know if it's emotional intelligence or music intelligence, because like you see it, like some DJs, they can't get anyone on a rhythm. And then some of them, they're like every step of the way, they get a rise and they make the people fall and bend
That's a great
up and
great
down.
analogy.
It matters
Yeah.
how much drugs the audience is on.
Yeah.
Well, that too, but
Yeah, but you can get there
Even
without it.
without it,
But
yeah.
that's what I call
without.
becoming the DJ of your life.
Yeah.
Because just like everything else you were talking about, you need a program in place that
Yeah.
people can adapt to, right?
Yeah.
And a way to manage and navigate their energy.
Yeah.
So it's not just random experiences where you have that, like you're laying down for the sound bath. What would happen if you decided to use some of that for sleep? Like I was listening to one of your
Yeah.
shows. Which one of you guys has problems sleeping, or was it?
I don't. I just use
do.
different ways to
Yeah.
like, and I've got pretty good control of it.
Yeah, good.
But I found that, like, you know, if I'm not on some peptides that are growth hormone peptides, it definitely reduces how much I get deep sleep. So, and I track everything, so I'm like pretty on top of it.
I got up
with what
today
I do.
with like 8 hours and 30 minutes of sleep, which is rare.
That's great.
Like I usually get up at like 6.5 to 7 hours.
Yeah.
So like today I was like,
Wow.
right when I got up, I knew I got like a lot of sleep because the sun was shining, but I was just like, I got a lot of sleep. I feel really good.
That's good.
But like that one, the sad part is like that one day of over 8 hours of sleep, I feel like that's replenished me for the week.
Yeah.
But it
I need to
always-
hit that 1 hour mark of deep sleep. I know if I hit that
know if
1
you
hour
don't get the
mark of
deep-
deep
yeah.
sleep,
Yeah.
I'm
You
like,
feel it,
I
yeah.
want to hit the snooze button in the morning.
Right.
But if, like once I
even at
cross
that-
that path, I'm like,
Yeah.
even if it's 3 a.m, once I hit that 1 hour, I'm like, shit, it's going to be tough to
You
get
know,
back
I
to
want you.
sleep.
Right, right.
I would challenge you to not just look at your wearables,
Yeah.
but how do you feel, like you're saying, and really make that, because
Yeah.
there have been FTC and FDA actions against a lot of the wearables
Yeah.
because they're not as accurate as we think they
Yeah.
are.
Oh,
They
no, I
give
don't
you
think so. Yeah.
permission. I mean, you start looking at trends and you
Yeah.
go, okay, this makes sense. But I know people that think if that says this,
Yeah.
no matter what I'm feeling, that's got to be right. No, not
No.
necessarily. Always be listening to the
pretty
body.
big with it, not
Yeah.
just for like wearables.
Yeah.
What we're talking about is
Yeah.
like what we're taught to like think of certain measurements mean certain things.
Yeah.
Like it happens a lot, even labs and stuff. It's just like it's just a marker. That stuff changes day to day, and
Yeah, like wearable anxiety, like people,
Well,
you know, like,
That's the thing.
you know,
That's
it's like
a thing. It's a
Exactly.
real
Yeah.
Exactly.
thing.
my main
living
thing
on
is
wearables.
if, you know, like if I don't hit that 1 hour deep sleep and it shows it, I'm like, I know why I feel
It's
tired.
verification of
But like,
yeah.
I'm like, oh, I really like sucked at sleeping tonight. You know, I gotta do something. Either I never get nap time during the.
stop being an
You can
asshole.
tell. You can tell. You didn't get enough sleep last
You get
night.
less than an hour of deep sleep.
You know
last
you're
night.
enjoying. Yeah.
I don't get nap.
Oh, even
time
if
during
your
the day.
marker told you got more than an hour, like I know you got
You
less.
said the
'cause
marker,
you're
yeah,
acting
yeah,
like
yeah,
a jerk.
You heard it here. That is the key. Stop being an asshole.
Yeah.
Right? Yeah. Because I think we have to ask ourselves, why do we want to live longer?
Yeah.
Right? If you just
Yeah.
want to
Yeah.
live
Yeah.
longer to be an asshole for another 20 years.
Yeah.
Right,
Like
then-
look at Brian Johnson. That's like the typical.
That kind of actually like
Yeah.
it's a good
Right?
point.
It's
I
just
mean-
like, and a lot of it, like we speak about, just look at Brian Johnson. I like, who looks at that guy and is like,
know.
I want to live
I wanna
longer
do
like
that.
that guy. Like,
That's
I
the
want
point, right?
8
You
years
wanna-
subtracted to live miserably and take 300 pills and eat broccoli for breakfast, lunch, and dinner.
MRI scans
Yeah.
every
I mean,
one
there's
month.
that joy factor too. Like you want to enjoy your life
Quality.
while you're being here.
Yeah.
How are you?
I don't
manag-
know. I want to bleed my kid and take their plasma. I don't know about you guys.
And their fecal matter,
Actually, I
right?
think you should be
like
creating-
the
I wish I had
microbiome.
more kids just so I'd have access to more plasma.
I think you missed your
They're
calling. I think
great
you
to
should be
hang
making
out with.
T-shirts. Like these are good T-shirts. Yeah. You know, don't be an asshole. I want my kids' plasma.
Yeah, give me a plasma.
More plasma.
Those young cells are pretty
He
potent,
does.
aren't they? Yeah.
He does. Like I agree with a lot of stuff he does and says, and I don't agree with everything, which is the polarizing world we're in, where it's like, oh, okay, you're you're this or you're that. It's like, no, I actually scientifically, some of the shit he's doing makes sense. But some of the stuff's like kind of bonkers. And he does look like a vampire. Like he legit looks like a vampire.
I know. Yeah.
Like what's that show in the shadows?
Barnabas Collins.
No,
Dark Shadows.
Dark Shadows. Yeah, no, he's talking about something different.
Oh, okay.
Honey, you're aging yourself when you're talking about Dark Shadows. These guys don't even know what that is.
You might be a vampire.
Yeah.
It's the guy Jermaine
And the thing is, there's no one that can say when you stack all that stuff, how does it work together?
Yeah, exactly.
And in that person.
Yeah.
We don't know.
Yeah.
So how can
that's
you
where like that's where
just
like
bleed your kids. We don't know how things are going.
Yeah.
So bleed your kids. Take their.
That's the thing. That's always something
not
that
know.
I'm like, all right. Like some people say you shouldn't stack this and this, but like, does it really make sense?
There's certain things we know that don't do well together.
Yeah.
You know, you can't do St. John's wort with a lot of things. I mean, we know certain interactions.
Yeah.
Others we have no clue.
Yeah.
And we certainly have no clue in you.
Yeah.
Or in you. How is that going to work? So I always say more is not better. I've got to have a real reason to put somebody on a supplement.
Yeah.
Then the next step is what is the quality of that supplement? Because that's a real hard problem. And here's the problem. Even if that supplement has a study behind it or has this, the testing that was done, I just had a conversation today with a group that we're looking at. When we double blind a lot of these health and wellness type functional medicine tests, that means you put the same patient's blood or whatever it is, saliva, same day, two different names, they better come back looking alike. They're not.
Yeah.
They're not. So how can we trust the science behind the things that we're taking if the labs are faulty?
Yeah.
So we're talking about, we've got a lot of cleanup to do.
Yeah.
That's why I always go back, how do you feel?
Yeah.
How are you sleeping? How do you pooping? Where's your energy?
Yeah.
The basics. How's your cognition?
Honestly, how do you feel? Like
How do you feel? Your cognition.
Fucking diarrhea for 3 days in
Right.
a row.
Right. Got a
There's
problem.
something probably not right.
Right.
Like, just
Exactly.
Don't
Exactly.
eat that. Don't
Right.
don't do that.
Yeah.
Stop going to that same source.
Yeah. Yeah.
So
It was just that, you know, the patient today, he doesn't have cancer. He's been a patient for a long time. Really a biohacker, watching every marker, everything, wants blood work all the time. But yet his blood pressure's still a little high.
Yeah.
Cortisol's still a little bit high. You know, hemoglobin A1C even, and he doesn't put anything in his body that would cause that. It's all stress related.
Yeah.
Because he's stressing over being so healthy, and he knows it. We laugh about it, and he's getting better.
Yeah.
But
Well, that's the one
you
thing.
gotta
that
have
meditating
him
or
coming
no?
in there playing
Yeah.
the action.
well, I mean, that's the
Like, let me soothe you.
yeah.
And I mean, seriously though, most people are not looking at stress and how they're managing their stress during their day. Why aren't they getting sleep at night?
Yeah.
Yeah.
Oh yeah.
And how are they waking up in the
Yeah.
morning?
When your mind's
How are they-
racing. Yeah.
No, that's the thing.
How are
Yeah,
you
so
right?
How do you
Are you
turn
not
that off?
processing your day, right? Or not? And music can help you wind down to do that. And we're looking at our phones in high beta right before we're going to sleep every night. Or do you want to wind down for an hour and listen to some music?
My wife
Even if
always
it's
makes fun
even
of
if
me
it's
because I
Nickelback.
have a head apparatus on like every night and like
Don't listen
calming
to
myself,
this
going to sleep,
Guy's
doing
a
breath
lunatic.
work.
Better than a CPAP. That's great. Yeah.
That's
You
great.
know.
And I mean,
But,
recovery too, right? I mean,
Yeah.
sleep is one of the biggest things, even in athletes.
Yeah.
If you want to look at how you're working out, that's great for peak performance. But we're knowing more and more that if you can get a half an hour more sleep, can you knock off a half
and
a
the
second at the
type
finish line?
And the type of sleep.
It's the type
That's
of
right.
sleep.
And the type
That's
of
right.
sleep.
That's
type
right.
of sleep. Because if you're lying in bed, that doesn't mean much. If
Right.
you're
Yeah.
actually asleep,
Yeah.
like that.
If you're going to sleep with those brain waves fast and incoherent, all different space, if you're going to sleep like that, you can fall asleep, but you're still
don't stay
dreaming
asleep
like
that
that. You're not in this smooth, orderly rhythm.
I'm telling you, today I got up
Yeah.
and I looked at my. I knew I got good sleep.
Yeah.
It was just like it was
Feel it.
like within like the first time in like 2-3 weeks.
Okay.
I was like,
Oh,
wow,
this is awesome.
like this is like I feel good. And I looked on the thing, it's like 8.5 hours of
There it
sleep.
is.
I was
You're
like, holy shit, that's
Good.
2 more hours than what I'm used to.
What if
And
you
it's
could do
just
that
like
every night?
that's what's that?
What if you could do that every night?
I didn't.
could you
I
accomplish in
didn't drink
doing?
as much.
Well, there you Start making
Like, that
connections,
was-
right? Connections.
The main connection for me and my
Yep.
sleep
Yep.
is drinking. If
Yeah,
I
I
have
can't do
a single drink within 3 to 5 hours, like they say, like even Peter Attia said, if you don't have a drink after 5, you should be fine.
Yeah.
Like my last drink needs to be like 3 p.m.
Yeah.
for it to make a difference.
Yeah.
So I think for me, it's not for everybody. Like I just need to cut out alcohol. Like,
Some of the guys don't want to, like, I think
Yep.
they want to keep their fan base and they don't want to say, don't drink at all. And
Right.
because a lot of people have their glass of wine and they think it's
Sure.
healthy. So,
I got to
you
drink
know, they don't
want
want to
to
push it and be like,
for my sleep to be normal.
Then I
Like,
say, do you have an APO44? If you
Yeah.
have that gene and you have family history of Alzheimer's, you have no business
it doesn't
drinking.
matter if you're a human
Right.
being. If you have
Right.
23 chromosomes,
Right.
you're
Yeah,
gonna
there you
get
go.
up
Yeah,
at
yeah.
3 a.m.
that's true.
and not be able to fall back
That's
to
true.
sleep.
That's true. Alcohol
that's-
later can't do it. And the older you get, the worse that all becomes.
That is very
you
true.
cannot. When you were 18, you could probably do it,
Yeah.
right? But the older we get,
And now that I'm
do slow
19,
down.
it's a little things.
so
You just sleep through it.
Yeah,
Just like
well,
somehow
yeah.
able to sleep through it.
Yeah.
Like, I feel like shit. Let me just sleep some more. Now,
Right.
when you're over 40, you're like,
Yeah.
let me
Your
get
liver's
on
not
there,
as
look at my
good at
bank
processing
account,
it.
Let
That's
me look
right.
at Instagram. Let me
yeah,
look
yeah,
at like
that's right.
Chase account.
And
like,
all the
I have a question for you.
responsibilities.
Yeah.
So with that 8.5, like how does that move into your day? Like what changes in your day from getting more sleep? Do you have more energy? You feel more focused? Like does it ripple out?
Today, I felt like I rolled out of bed and I was just like, anytime I wake up, I feel like I got cut short of sleep. That's just how I feel from like being like 12 years old or however long I remember. But today I was just like, I feel like I wish I could get another hour sleep, but I was like, I feel good. And I got up, did like a 40-minute like leg exercises, resistance training, which I've been better about, but like I just didn't even question it today. I felt really good.
But why did you sleep better last night? Did you look back at your day and your night
I didn't
before?
drink as much. The day
Okay,
before.
that was the only confounding
And-
factor.
and
Are you
you're
less
drinking every
alcohol.
day?
I have been.
Okay, well okay.
I drank less last night.
That's
and
great. Then you
I
make the
stopped
connections.
Drinking
Okay.
a lot earlier.
Well, there you go.
Like it's saying like 4 or 5 hours earlier.
Yeah.
going to
That's
bed.
how we learn. That's a biohack that you say, for me, I can't, if I do this, this is what happens. You got to make connections instead of just, oh, great, I got a good night's sleep. Felt
I
great
hate
today.
to
But
admit
why?
that. I also hate to admit that because
Yeah.
it's like, okay,
Yeah,
I'm an
it's not as fun.
alcoholic.
Yeah.
Because like
Well,
my alcohol consumption is getting in the way of my like
Okay.
daily function. It really isn't, but it is getting in the way
Of your sleep.
of my daily optimization.
Yeah.
Like
Yeah.
I'm gonna skip this workout because I drank alcohol, I slept later, I didn't get up early enough to work out and stuff like that.
Yeah. Well, that's what we're
makes
always
sense.
doing, right?
Yeah. Yeah.
It's making connections. What makes me feel better? Do
I have
better,
been taking
Yeah,
supplements.
I stopped drinking like 3
Yeah.
years ago. I did plenty of damage in the earlier days. And
Yeah,
Yeah.
I always
Like
thought he was a robot, and now I'm convinced he is a robot.
like my brain
It's like,
functions at a
thank
different
God,
level.
we confirmed this
When
3
your
years
brain
ago.
functions at a different level, you're like, I don't want to go back to that. You know,
yeah.
even for a day, I'm like,
brain and body.
I'm good not
It's
to do it.
Yeah.
like I can't believe I keep reverting back to it.
Yeah.
It's not like stuff we say people should never do, but it's like, okay, go ahead.
Yeah.
Play with it
Yeah.
and then come back to who you are.
If it starts interfering with your daily life,
Yeah.
or your overall, then you say, I've got a problem.
Yeah.
I think, I don't know, biohacking is changing, I think, the older you get, too, and it
Yeah.
changes in age. Like,
Big
for
time.
me,
Big time.
like, I think about why do I want to live longer? Like, as I get older and older, I'm moving more towards, and it becomes very real when someone that you know is like 80, and you're like, wow, they're only 15 years older than me. I start thinking, wow, I really want to work optimally, not just for my physical body, but for my mission, my purpose, my legacy. Like, what do I want to leave behind?
Yeah.
You start thinking at a different level
Yeah.
from just the physical body of really why that's important to you to live longer.
Yeah.
You know, not just for measuring the things that we can see, but the things that you can't see that you want to leave behind to leave your imprint.
hear
And
about
that
that
becomes
too.
more and
Yeah.
more part of my biohacking.
You're switching into like that next stage. I was talking to my friend. It's like, because I was at her friend's dad's funeral. Like, you know, you're getting old when you're going to more funerals.
Right.
That's true.
Oh, absolutely.
But let me bring up this, the way we're supposed to age. My dad is almost 92 years old.
That's
we go.
awesome.
He golfs 18 holes about 4 days a week. If he'd do more, if he could have the time, he dances almost every night, and he goes to the gym and strength trains. But he started having some neurological shake about 2 years ago. I saw it. It's not Parkinson's, but Parkinsonism.
Is he single?
This is the thing, yes.
He is very.
But he went through a horrible divorce at 89 or something. So here's the deal. He does hyperbaric oxygen, ketogenic diet. He strength trains. He does all these things, and he's got more. We're living our lives through him vicariously.
He comes
He's
home
got
with
girlfriends.
stories, and
We take him
it's
somewhere
amazing.
he's got a date. Literally.
Seriously.
Finds
We're
a
not
date
even
that
lucky.
night.
Okay,
So,
gotcha.
but
Exactly.
so what's his passion and purpose? Ours is our work, all that. His is he's just enjoying the
Every day.
attention.
That's what
and
matters.
and-
That's what
That's
matters
the
the
thing.
most for everybody.
That's right.
Yeah, my
That's
dad
right.
walks like 5 to 10 miles a
Yeah,
day.
that's
like,
walking
every
too.
day,
Yeah,
and he's
that's
like,
right.
he's
We used to
77.
live close to him, and it was
Yeah.
just like we see him walking in the neighborhood.
Yeah.
And he saw us like going through his loop, and Sarah, Ari, and I, my daughter, wife, and I, like stopped and like, oh, this is Dad. Let's say hi
Yeah,
to him.
that's right.
And all he does like just looks up.
Just like, okay, go ahead, go on. I'm on my walk.
Don't
I'm
interrupt
on
me.
my
Right?
way. I'm
Don't
like,
interrupt. That's
Dad,
right.
stop being an asshole. This is my wife and kid.
He's got his priority. This is my dad. Get your priorities
He's
straight.
like, I gotta get my
It's
steps
priority
in.
step.
I
That's
gotta
right.
get my steps in.
That's
and
right.
You little assholes cannot get in the way of that.
That's true.
But that's what keeps him ticking.
That's the
It-
thing.
it's-
Everybody's different. What keeps you ticking? And we should age that way.
Yeah.
You know, I have 40-year-olds coming, oh, I've got aches and pains. I'm just getting older. I said, that is never an excuse.
No.
In my clinic, never an excuse.
I gotta
There's a
tell
reason.
you, a lot. I
Dude,
think
I have
fine.
less pain.
Yeah,
And feel healthier right now at 45 than I was at 35.
Right.
yeah, and I gotta
Right.
tell you,
Age
aches
is
and
not an
pains
excuse.
is probably more of a symptom of slowing down and depression than it is an actual core
big piece
problem.
there, yeah.
Where like people are like want to blame it on something, and it's just like dude, just stretch, just stretch every day. Take a few more steps. Take like 2,000 more steps a day. Listen to more music, or like what's going to provide you joy. These are more symptoms of depression than they are from you getting old, and people tend to put that into cycle, and it gets out of control.
That's right. You say,
Totally
why do you have
agree,
that
yeah.
symptom? What happened? What if you keep asking, but why? And they say, well, my family had it, but why did your family have it? Why? You keep asking, it usually comes back to an emotional something
Yeah.
that's attached to it. It really does. And until you get to that core root, you're dealing with symptoms, and we're probably all pretty good at helping people with their symptoms. Feel better, look better.
And
But-
ourselves too.
Right. But it's, what's that core?
Yeah.
Yeah.
Had a patient today, I was just like, procedure will not help what you're feeling
Yeah.
and what you see. This is the last thing that could be done, and I can do this procedure, I can take your money. It's not going to help you out. It's not going to help the way you feel about yourself. So let's work on that, and let's see how we can like
What was the procedure?
facelift.
You know what? And I love that, and that's a good doctor. But that's a good, honest doctor, right?
Yeah.
And I have friends, they've had 3 or 4 facelifts, you know. I mean, but for me, I'm just like, no, I've got my purpose and my
Yeah,
passion.
some
mission.
like I had a patient. She came and asked me. She's like,
Patient?
"My friends say I shouldn't change my face. I'm okay with it." I'm like,
What do you want?
Yeah, I'm like, what do you want? You
want?
obviously came in here because there
Yeah.
was something
Yeah,
that you
bothering
didn't
you.
like
Yeah.
in your mirror.
Yeah,
So you're
And you
here.
look
It
at
doesn't
in the
matter what
mirror
your friends
every
are
day.
saying.
That's right.
It's because if your friends had the chance to do it, they'd probably go
Yeah.
and do it too.
yeah.
But they can't get it done, so they don't want you
right.
to get it done.
You know, sitting on the Naturopathic Medical Aesthetic Board.
Yes.
I was on there because I studied in France. It was the mesotherapy and all that. Just,
Yeah.
you know, the mechanical damage that you can do
Yeah.
that help the body build some collagen. But, you know, it was funny because some patients you could do one little tweak and they're happy. Thank you so much. Life has changed. They feel better and it makes them better.
Yeah.
But then others, no matter how much you do,
Yeah.
how much good work, they're not happy. They're never going to be
Yeah,
happy
yeah,
because it's
exactly.
inside.
Yeah.
They're not. They don't like who they are, no matter how good you make them look.
That's how we decide patients.
Yeah.
It's like, are they
Yeah.
surgical candidates or
Right.
not? Are they going to be happy? If we really think they're not, like, it doesn't matter what you do the best facelift,
That's right.
the best rhinoplasty, the best boob job. Like,
You got to
they're
look
gonna-
at their motivation, what their motivation is.
Yeah.
And it's got to be their motivation, not someone else's motivation.
Their
for them to
husband
get
or
it
someone
done.
else's. I want you to have this.
They're recently
booty.
divorced, or you know,
Yeah.
they think
That's
something
right.
minor is going to
That's
make.
right.
Yeah, but anytime, like you were saying, like they come in, they're like, my friend said they can't do this or can't do that. Is like my thing I hold inside and not say out loud is like, well, your friend's clearly ugly.
All right, we can't post that one.
The things you can't say, but you want to.
Inner thoughts and outer thoughts.
Yeah. But you know what, you guys,
should've kept
it's
that out of this
refreshing to hear you, though, because there are many people in the aesthetic world
Yeah.
who would take any and all comers, take the money.
Well,
and
the
just hope
whole
they don't
whole
come
thing
after
with
you
the
guys- yeah.
aesthetics is like, you know, like I've always like when people like tell me they put more than 2 syringes of filler in anyone, I cringe and I'm like,
How do you fill that? Where do you
I'm like, you know, and
the
they're
tomato
doing,
face. They
they're
have no
doing
contour
10,
to their face.
They're
They're
doing
round,
10,
fluffy. I
12
can see it.
syringes. And I'm like,
Yeah,
you might save like that lady. You might save her from getting injected by the wrong people.
Yeah.
Saying they're going to do a liquid facelift, them injecting 10 vials that only maybe last 2 years.
Yeah, at most.
At most. And then they're back doing it again, and it's just making them look worse and,
And
worse.
it's not a natural
So
look. I
sometimes
mean,
you can
it's
give them the natural look with a facelift.
Yeah,
today
yeah,
was-
that's right.
But like, no, you probably made the right decision. I'm just saying,
Yeah.
just in
Oh, no,
general,
yeah.
these days it's like moved to, and I tell them I'm more into PRP and
Yeah.
fat grafting
Yeah.
and stuff.
Yeah.
It's
Even
stuff
peels,
that's not.
chemical peels.
Yeah.
for
Oh yeah. There's.
wrinkles.
Yeah.
Yeah.
I had a couple come in, and they're in their 70s, and one of them has been regularly doing chemical peels. They're both light skinned,
Yeah.
and one has not. And it's like, yeah, like I want to be able to guess that you guys were both the same
Same age.
age.
Yeah.
So like
Yeah.
proper skincare,
Oh, yeah.
doing the right things,
Yeah.
like it adds up.
Yeah, sure it
And-
does.
And that, I mean, it kills our business. Is like less facelifts, less brow lifts, but
But you can do so many procedures and thin that skin so much
Yeah.
in the long run.
That's
So
the shiny people coming in.
That's the
that have
shiny
showing
people
red.
coming
I'm
in. You're like, you touch
I
them
don't
and
know
they'll
if-
scratch.
I know.
Yeah, you're
I'm
gonna
like,
probably
I don't know
shred
if
their
that
skin.
stuff's
Yeah.
gonna stay together.
Yeah, but
That's why we put them in hyperbarics right away.
That's right.
our
That's very
hyperbarics.
smart. That's
like I was
amazing. Yeah.
asking you for wellness
Yeah.
stuff because like we have
That's right.
hyperbarics, we have
That's
red
right.
light
Perfect.
therapy
Yep.
are 2 main things post-operative care.
That's right.
And we're building a surgery center and we're
Yep.
going to put like a 4-person chamber in there to
That's perfect.
like be able to have more comfort.
Hyperbaric is
Yeah.
amazing. I'm
We're
so
gonna
glad
blow
because
that
you guys
up.
are
Yeah.
red light, well, cold laser, red light
Yeah.
laser, even infrared, but red light and hyperbaric.
I
Those
love
are two
red
that
light.
should be.
I love.
That's
red
what I have
light.
been lecturing
Yeah.
for. My mentor was Bill Tiller. He was in the movie What the Bleep Do We Know? But he was the science guy that nobody could understand. He was the chair of the physics department at Stanford
Yeah.
for 40 years. He taught me the right questions to ask. So when
Yeah.
I started talking and teaching docs about laser physics,
Yeah.
red light is just
So I bought this
amazing.
red light mat. I had lower back pain
Yeah.
for like 8 months. I tried peptides, everything,
Yep,
stretching.
yep.
It wasn't getting better. I bought this red light mat. I'm like, all right, they were at the 8-4M
You
meeting.
lie on it?
Yeah.
Is it an LED or is it a laser? Is it
It's
like
it's
630?
LED and it's got infrared lights.
Yeah, okay.
It's like a 6-in-1.
Yeah.
So it looks like an Alibaba thing, you know?
Yeah.
But
Eight in
it's
one.
like it said,
Yeah.
the company says they're made in USA, but their entire site looks like it's straight out of
USA is
Alibaba.
spelt wrong.
You know, but
It's assembled maybe in USA, but maybe
I
not
know.
made in USA.
I know.
I'll
I
judge
Feel
if
better?
this is made
I
in the USA
religiously
by the
go
amount
on
of
that thing.
terrified.
Like every night, I lay on it as I'm putting my son to
Yep.
sleep, and
Yep.
it's like 30 minutes every night. And 2 weeks, like my lower back pain,
Yep.
completely gone.
So I
Like
challenge you, was it going to go away without that or not?
I don't
But-
think so. I
okay,
had it for
so
like
I'm
8
asking.
months. I had
Okay,
it for
all right.
8 months. Tried everything.
LED
Been
can
using
work.
Yeah.
LED is
have you
good.
been using the
The laser.
pivot tools?
I was, but that wasn't doing anything. I was actually getting more pain.
I was going to
with that.
say that
Yeah.
might, yeah.
Yeah, I
Could
actually
irritate.
tried it.
Yeah.
Yeah.
It could irritate. No, red light's underutilized, and I love it. Now,
Yeah.
I would
I
say
hate
red
to
light
admit
4
how
hours
much-
away from hyperbaric, though, sometimes. If it depends.
4
With
hours away?
cancer, we do. For the, you don't have to, but that's what we are seeing in our science, the research that we've got coming out.
Why
red
is
light.
that?
The only sorry, the one reason I like went towards red light
Yep.
is I had like 2 patients after a nose job that
Yep.
came in with like, oh yeah, I have the red light mask. It wasn't like an expensive red light
Right,
mask.
right.
It was like
Probably
just
just
something
LED
like
then,
at
yeah.
Sephora.
Yeah, it's an LED.
And I was absolutely shocked with the amount of swelling and bruising that resolved
Yep.
within 1 week.
Yeah.
It
Yeah.
like we did a nose job on my brother. He went through it all, and he had horrible swelling,
Yeah.
bruising.
Yeah.
Like them, I was just like, did I
Yeah.
operate on this?
You-
What am I doing right? This is
Right.
great.
It's exactly right. You know, post and even pre-surgery, using these laser techniques for 20 years now. I've been using it, and healing fractures after surgery. They go back, and the surgeons are always like, "Oh my gosh, this is half the time and better effect than we would expect without it."
So what's the science behind the timing between hyperbarics?
Well,
and red light?
it's new, but it's coming out. Some of the science, Dominic D'Agostino is out of the University of Southern Florida.
Yeah.
He's funded by DARPA, by the Department of Defense. He's been entrusted to look at what are the best therapies to make our super soldiers faster, better, stronger, right? So from
Russia's
the
already doing
Navy
that.
SEALs, and so all of that, you know, I follow. He's part of our international group, Society of Integrative Metabolic Oncology, and I know Dominic, we're good friends. So I follow what he's got going on, what he's seeing coming out of there. So right now, our hypothesis and thought and what we're seeing is that they need to be apart. It's just mechanisms. They may interfere with one another. They're not harmful to do it, but you're going to get better effect if we have about a 4-hour window.
No, because
Oxidative antioxidant.
Yeah, because we have
like,
our patients, they do hyperbarics and then they go and do the red light right after it. So it's, you know, it's back to back.
Yeah.
You do
For
before too,
post-operatively.
right? Red light before the hyperbaric as well.
Well, it depends what we're doing. For cancer patients, we do red light, and we'll say do that in the morning and do your hyperbaric in the afternoon, or 4 hours apart.
What do you think about all these like different lights? You know, like something that's coming big in the aesthetic industry is this Elixir MD that has like yellow light post surgery day
need more
1 through
lights.
3. No, it's like yellow light or blue light and
Okay, so
this
there's-
other
yeah.
garbage. And I'm like,
Bullshit
all
light.
I want is my red light bed, and
Right.
that works.
red light,
plenty
blue
good.
light,
Right.
Bud Light.
You're back to the Bud Light
Yeah,
again.
there you go.
No sleep tonight.
Yeah.
No sleep.
So, yeah.
Bud Light.
Not after
No,
3.
Bud Light
Not
has,
after
like,
3
no
p.m.
alcohol in it.
Yeah,
I should
not
drink
after-
like 25 Bud Lights and go to
But you're going
Go
to
to
wake
bed
up
just
many
fine.
times.
That's
You're
right.
going to wake up at any time.
So the phototherapies, I think,
Yeah.
is the wave of the future. We need to start using it more. We need more science behind it. There's not a lot of people to put money behind it because there's not a lot of money to be had. But I do know, again, from my mentor, the farther you get out on that spectrum toward ultraviolet or radio frequency, whichever, you're getting more harmful. We have more science in red light in that visible red light and what that does, and we've got a lot of good science with that. The farther away you get from that, like lavender, we had a lavender laser that was being used aesthetically, and it was being used for weight loss and this and that, and I talked to Bill Tiller about it, and he said, you're way too close to the UV light. He said he thought it could be cancer causing. So, and even green light.
And it didn't have the lavender scent. So.
No, to go with it, I don't think we know enough about it yet, but blue light, yes. I mean, fungal infections, we know these things can be powerful, but for the things that we're talking about, red light's a safe place to go.
Yeah, that's what I thought, because it's got, I think it's got the blue light at the beginning to maybe fight off infection or something.
And that's okay.
Or yellow light to be like kind of
there's not as much on the yellow
I know,
light.
I know
that's
there's not much.
So
far. I was like, I'd rather get my fancy red light. And, the red light bed we're looking at has like, I don't know, it infuses hydrogen, and on top of it you got like vibration acoustic treatment on it too. So you're getting all
starting to layer things. I would just say with a full body red laser, red light, we're a little concerned about that with cancer. If you put it directly over a cancerous tumor somewhere, because it causes angiogenesis, that new growth of blood vessels for your listeners, right? Don't do a panel, do something, but don't put it right over the tumor.
That makes perfect sense, because you don't want to like hyperpower cancer.
That's right. You don't want to give it the blood flow to grow.
The cancer, pretty much all our patients, the cancer's cut out. So then we just want
But not all of it sometimes. So they could still have it in their lymph
and
nodes.
you got to always say, just because you get a tumor, they go, they got it all. And they go, no, I didn't, never got it all. You got all of the tumor that you could see, but there's cancer circulating tumor cells everywhere. So I love red light.
That can lead you to say, like, I don't need or want any of this. So where it's like speeding up the blood supply and everything to whatever it is, your skin, subcutaneous cells, like it's always a balance. So,
but are you kicking more immune cells to kill the cancer too?
Well, that's the thing. I mean, you've got a bulk of a tumor. Always take that. In my opinion, you take that out.
For sure.
Let the immune system have a chance to help take that out. I had a physician. I've had several physicians that have come and said, I will never do surgery. They found out they had cancer, and I go, what are you thinking? Here, come on, let's do just some basic common sense here. Take out the bulk of the tumor. And now let's do all the things that we're talking about doing. But no, angiogenesis, we got to be careful with that blood supply. Got to be careful.
Yes, I don't know. I think once it's cut out, you got to feed the rest of your system as much as you can.
Well,
that's my thought process.
Well, that's our metabolic we do.
I think you do it with hyperbaric
You
chamber.
do hyperbaric and red light. You do. It's just even though it's cut
that
out,
stuff
I'm not
can
sure.
feed everything in your body.
Not hyperbaric. Hyperbaric kills off your cancer cells.
It decreases tumor cells size.
It does, but like what you're arguing technically could feed the...
No, not hyperbaric oxygen.
No, not hyperbaric. It drives that oxygen right into the cell. So,
but that cell can have a tumor in it.
Yeah, but tumors don't survive on oxygen.
That's exactly right.
It's not necessarily on oxygen.
It's very rare.
It
Tumors
survives, but
no, it doesn't.
You can feed the tumor with
it's all
oxygen.
good hypothesis, right? But I will say the science is, as far as we know right now with hyperbaric, we see it as being protective.
Tumorigenic.
And
I believe it too. I'm just I'm playing the devil's advocate.
It's good to always do that. We should always do it.
No, I'm his brother, so I want to disagree with him.
It helps with chemosensitivity and radio sensitivity. Hyperbaric helps you use less of those things with a better effect. So when we start looking at that, we go, okay, let's play with conventional medicine.
Which atmospheric pressure,
though? For cancer, you got to be at 2.1 and above. Right?
Okay.
You got to be in a hard shell. If you're doing aesthetic and you're doing anti-aging, you can be in the soft shells.
We have a hard shell at our...
That's great.
It's a hard soft shell, though. It goes up to 2 atmosphere.
Yeah. So 2.1 and above, 2.1, 2.4, it depends on the size of the tumor that we'll do. But like you said, you guys have...
2 atmosphere.
Most of yours are post-surgery.
Most of ours are post-surgical. We don't
post-surgical,
need it. We're not treating the cancer treatments.
Right, which we're not allowed to either, but our science is showing that what's happening. we think it'll be indicated soon with the amount of science. But with what you guys are doing, you don't need to be
as
at
long
that
as
high
Donald
level.
Trump doesn't say it. Keep it out of his mouth. And
Aceta.
And I voted for him, but like,
Yeah.
I'll vote for him again.
Yeah.
But,
you know what? We look at the alternative. Yeah.
But
I know.
Melania Trump definitely ate a shit ton of Tylenol when she was pregnant with Barron Trump, according to what's been released today.
Oh my gosh, really? I haven't seen the news today. Okay.
That was the big
Tylenol
announcement
thing.
is
Well, I know that was
Tylenol.
about autism and
Oh
Tylenol
no!
and
Today was the big announcement that
I have not
Tylenol is the.
well, no, we knew that, but like,
Right.
Or did he
say something
Barron
about
Trump?
No, he didn't.
just because
but
he
Barron
looks-
Trump
he
is
seems
autistic
autistic?
as fuck, and
smart as heck though.
Yeah.
supposedly.
Yeah.
You don't know.
Watch that kid and what he's been doing. I'm pretty impressed.
When you have the type of clout that he
well,
does,
yeah.
where like
Yep.
where like somebody else's kid might not have that type of clout. Like I don't underestimate how smart he is, and I actually think what Donald Jr. and Eric have done is actually very, very smart. I won't take that away from them, but he's definitely on the spectrum.
Yeah.
And his dad comes out and says, "This big finding says it's about
Wow.
Tylenol, so." Melania must be taking a shit ton of Tylenol. But
That's
I
a good
actually think-
hypothesis.
I actually
gotcha.
think like even though the it kind of doesn't make sense about the Tylenol leading to autism. I do think the reason you need to take Tylenol in pregnancy is because of fevers and pain. You've gone through some stuff, and that stuff might lead to the autism with the birth. Probably lack of oxygen. I don't know.
Right. But you
But
know the
that's
whole
me-
causation thing,
Yeah.
right? Just because something correlates doesn't mean it's caused by. Now,
Yeah,
in time,
so
we're going to
now-
know.
so
Time will have enough numbers in value, numbers of
You have
people
any
and
kids?
stuff to know. Yes,
How many pregnancies did you go through?
just one.
So
Did you
didn't
take
need to go-
Tylenol
I
at
did
all?
not. I'm like, I don't take
I know.
anything.
I'm just trying to
But
figure
you don't
out
need to
when
go
you would
through-
actually take Tylenol, because as an adult you
Right.
fight through your fevers unless
Yeah, you
like
do.
you're in
I
a
don't know. It's a
hospital, right?
pregnancy. Yeah,
and,
I just
and like
yeah,
what
I'm
sort
one
of
those
pain
that
do
There's
you?
a lot of people
What
you're
sort of
not-
pain do you?
Would you
take
have to
Tylenol?
have to say it's
Hangovers,
worth taking
right?
something?
Yeah.
Yeah, as a
Not
as
the
a
drinking
in
when
pregnancy.
pregnant.
Now I'm starting to
And
get the full
pregnant.
picture.
There you
Oh,
go.
there you
Now
go.
there you go. That's it.
There we
Maybe
go.
it's the alcohol.
Drinking
There we
Tylenol.
go.
Now it's all
Blame
coming
it,
together.
blame
here.
it on something else.
Oh my
Blame it on
gosh.
something
Oh
Alcohol
my
else.
led
God.
to the Tylenol,
Yeah, the
led to the
alcohol
autism.
would have been the
Don't take
big problem.
responsibility for
Right.
anything.
The cause was actually the alcohol,
So
not
I'm
the
just being
Tylenol.
quiet here.
There you go.
I'm gathering my theses.
Yeah, there you go.
Cleanse all pregnant females'
Feces,
livers,
Yeah.
and you'll be good.
feces
Yeah.
and feces.
There you
It
go.
always comes together.
Yeah.
It's true
It's
though.
so funny.
There's a lot of correlative stuff
That's
that like
right.
people like don't
Put pieces
put
together, it
together.
doesn't mean
And like it
it's-
just came to me today. It's like because somebody was like, "This is the only drug that's available for people that have fevers during pregnancy." I was like, "Why are they having fevers?" in
That would
pregnancy?"
be the question.
So
Because
root of the
they're
problem.
having an infection that's like, that could cause whatever,
And and it also could create antibodies so that the baby's immune system learns how to fight that thing that the mom's fighting. It's
Yeah.
called a vaccine type idea.
Yeah, they probably
Or
got a
the mom-
vaccine.
or the
I was
mom-
going to say they probably got a vaccine.
or the mom's fighting the baby. Like
yeah.
it's
I know.
it can happen.
What happened, years before. I always say less is more, right? Less is
Yeah.
more. More is not better. We don't know enough.
Did a few years of research
Yep.
at Harvard
Yep.
at an immunology lab.
Yep.
It was transplant related, but it's just like some of it doesn't make fucking sense. And you have physicians and like really top-notch physicians like fighting staunchly
Oh, well,
because there's one or two papers
Right.
and being like, okay, there's nothing on the other side. I don't want to say they're wrong. They might be right because
Right.
those 2 papers are really strong.
Yeah.
But like going on the other side, you're just like, dude, just be a scientist.
That's right. You're supposed to question yourself.
Yeah.
To death.
You're supposed to question yourself, your own results.
Right.
You don't want
That's right.
to like make
The
your results
authoritarian.
facts and
That's
then
right.
make a story
That's right.
behind
To
your
fit
results.
that's right.
Yeah, like my PI, principal
Mm-hmm.
investigator in Boston, he very close to getting like a Nobel Prize.
Mm-hmm.
And like I was asking him, I was like what, going through a few different studies because I had a few different findings, and he's like, it doesn't matter what you're searching. If what you're searching for is strong enough,
Yeah.
it doesn't matter
gonna show
how
up.
your
Yep, that's
findings are.
That's right.
Like if you're like, even if it's a negative finding, you're like, I studied to show this, and this was a bunch of bullshit, and like you're proven
Right.
wrong. Like that's going to be very informative for a ton of people going down the same research line as you.
Yeah.
Like you got to, like that tells like 50% of the field to be like, stop doing this.
Right. Stop
Like,
this and look here.
Does not
Yeah,
work.
that's right.
So,
But name a study. Can you guys name a study that you would say was 100% unbiased?
Namaste study.
No. Yeah. not. You can't help it. Even because I've been a PI. I have a research company.
Yeah.
And
Yeah.
you even though you're trying to be unbiased, you want to design this in an unbiased way to look and see, does this work or does this not? And what are the things that we would normally test for to see, is it working or is it not? But you can't help. My bias got in there.
Yeah.
You can't
it doesn't
help it.
matter. Like
Yeah,
I have
of my experience.
a few published papers and stuff, and there's biases in each of those papers.
And all of that's what I mean. You can't help it.
Yeah, exactly. Like
You try. You
try
be
to limit
honest.
it.
You're
try to
honest.
limit
You
it.
get, but there's no.
you know,
Yeah.
like somebody's got to publish me or give me money or something.
Yeah.
So
It's
this is
it's
the best
hard.
route I
Yeah,
could
it's so
take
hard.
for making this paper the right way.
Do you guys agree? And Barry, you too. I mean, that the more you learn and the more you know that we don't have a clue.
Yeah.
We don't know. The
Exactly.
smarter
That's a
I get, the more information
philosophical-
I have in my head of everything that I know in all these areas, the more I realize we really don't
Oh
know
yeah.
a
It
lot.
gets you more confused. Yeah.
That
Not
just
that they're
means
confused,
that
we
just
don't
means
know.
Yeah.
that just means you're looking and you're open-minded.
You have to.
Otherwise, like if
Yeah.
you're going to be closed-minded, you're gonna be
That's
like,
right.
I know everything. There's a limited amount
That's
of
right.
information, and I know most of it.
Yeah.
It's
yeah.
always like,
That's who
yeah,
you-
it's
you
always
question
like
those
you
people
see
right
how
away.
much information's out there.
That's
and it's
right.
like-
That's right.
and that's why AI's
I
bringing
know.
a lot
Let's-
of that
yeah,
together.
Yeah. We just lectured at the United Nations about AI
Yeah.
and how we can use it. And I talked about
Yeah.
medicine and women's health, and you did intuition and
Emotional and spiritual
emotional and
intelligence.
spiritual.
I was going to say with music though, I mean, there's only, there's 12 notes, and to see people, right,
Yeah.
who just continue to blow you away, and like, how are they doing that?
Yeah.
Like, especially like with things online, and you're seeing things that you would have seen. Some kid in the middle of nowhere who's like playing guitar like you've never seen it played before.
Yeah.
I remember when Stanley Jordan came out and he was doing the double-handed guitars and all that. We thought it was amazing. Now we're seeing so many different things. At the same time as AI and music is changing there, there's still people are still thriving for that one-on-one, that live performances, and that's where we're seeing so many concerts growing now because we're spending so much time learning about all these new tools that we need more downtime and we need to connect more with people.
Yeah.
So you have a lot of excitement going on, and then people looking for new ways to de-stress and connect.
Yeah.
So there's a lot more we're learning, I think, about humanity too, and even flow states, right? You were talking about flow states.
So
Getting to flow states, right? We're learning a lot more of how you can get there and the importance of it. And it's not more thinking. It's emptying the mind out that gets you into those flow states and those peak states. So it's great to be learning all these new things, but
you
at the
might
same
say
time,
emptying your mind out, and not thinking, but it is actually thinking.
Right.
And it is
Analyze.
It's access.
it is an active process
Right.
internally in the mind. So I've
Clearing out
been
the
But the more you
Well,
get the
it's
mind out
active
of the
to get
way.
inactive.
Yes.
You know?
Yes.
So,
yes.
like
Just
anything else, you know, the more that you practice something, and the more
Exactly.
you have an experience with it, and like even with the sound bath, getting back to that, you know, when you had that one experience, and I think you even said it, then you wanted to do that again,
Yeah.
and you knew that you can get there doing
Yeah.
it.
It's possible.
You have an experience and a basis for that. It's easier to get to because something that was going on within that not doing. Right.
Even
get there.
surgical or most people in like sports and stuff, they think through the process
That's exactly right.
of that
Vision quest.
situation. Where like most of the stuff that we do, people are like, oh yeah, you're thinking like an artist. It's like, no, I'm kind of fucking brain dead. Like I'm doing what I'm supposed to.
I wouldn't
I
call
don't
it
wanna say
brain dead.
brain
Yeah.
dead, but
No,
it's
yeah.
like I'm doing what I'm supposed to
Turn
do.
off the analytical mind so
Yeah,
that you can be more
and,
creative.
and
Yeah.
shut off certain
Yeah,
parts and
yeah.
activate other parts.
Yeah.
It's that meditative.
Yeah.
So
thought
it's
process.
We've seen it with our biggest
meditation and sleep.
scientists.
Meditation and
That's right.
sleep.
Einstein accessed
Yeah.
that as well, and he was a musician. A lot of people don't know he played violin and piano. In his memoirs that his kids wrote, they said they hear him from the other room going, after he played violin, I got it. Right?
Yeah,
and
it's
accessing
like-
another part of the brain where he wasn't having to think, but he still was doing something.
Yeah.
Right?
So like in surgery, obviously we're not like overreacting or anything, but it
Just knowing your next move. You know
No,
what to
sure.
do when, you know.
yeah.
Mental rehearsal.
Yeah.
Mental rehearsal
Yeah,
is
yeah,
like
it's big.
top-notch athletes do it all the time.
Absolutely.
Like I listen to
They know the next move.
I listened to Wayne Rooney, soccer player, which I don't listen to athletes because of this, but it's just like he's going over like, oh, the cross is coming in this way, and I'm like, am I gonna bicycle kick it? Am I gonna bring it down my chest and then kick it? And it's just like, I hate to think of myself as an athlete or whatever, but like that is the same thought process.
Yeah.
Yeah,
Tell
no-
them who you work with. Tell them who utilizes your music and why. This is interesting. Tell them who you're working with now.
Who am I working with now?
Deepak Chopra.
Deepak Chopra. Yeah. Oh, Dave. I've done music with Dave Asprey and 40 years of Zen and provided tones for that. Dr. Joe Dispenza. I've done a lot of music for meditation.
These are the leaders in the field of what we're
Daniel
talking about.
Amen.
But it's
Daniel
his
Amen as
music.
well.
Yeah.
Asprey,
Daniel Amen.
like I liked his books before. This new book, 40 Years of Zen, horrible. I can't even listen through it.
Heavily
Sorry.
meditated.
Heavily
meditated or
meditated.
something.
But I
Yeah.
think
Yeah,
it's-
I do
think
want to
it's
go
good,
to his
though.
40 Years of Zen, but
Yeah.
it seems like he's pitching it for the 40 Years
Well,
of Zen.
40 Years of Zen has been around for a while. And,
Did you guys do it?
I
Have you-
did a home version of it. I was beta
Yeah.
testing it.
Because
He
they
liked-
used some
he
of his,
liked
he
that
did the
part.
frequencies
Okay.
for
Yeah,
that,
and a
for
lot
that
of
Oh,
deal.
did you?
have,
He did the frequencies for those devices.
Because my wife wants to do something to like
Yeah.
just
I
clear
heard
up
it gets
her
that.
pretty
mind,
deep
and I was like,
emotionally. It's not just like, biohacking with brain
Yeah.
things. A lot of it is about letting go of trauma.
Yeah, it's
different
all
things.
just like
It's pretty
right now,
powerful.
just like reading through his. It just seems like he's trying to sell a lot of stuff
Yeah.
in that book, and he brings up 40 Years of Zen, which is his thing, and Upgrade Labs.
Yeah.
It's just like repetition. I'm like, come on.
But I think it is.
did.
I would say one. I think it's a good direction for biohackers to be thinking about too. That there are things that they can do
Yeah.
inside of them as well that they can access with without
Without
having to.
technology.
Yeah.
Or
Without the
adding it
technology.
to, right? Well,
Yeah.
let's try something that's non-invasive completely, right? And that you can access,
Yeah.
utilizing a practice, utilizing your mind, and getting
Yeah.
into a practice of managing
Yeah.
your stress more effectively. And I think
Yeah.
that's a direction that needs to be looked at. And I think that's why he's going.
And
So
what
is there-
people don't see is like with meditation and sleep and clearing out your brain of the bad stuff.
Yeah.
It's like, even, and I've said it before, like answering to my wife, like when I don't meditate or get that sleep, you're short fuse and you answer wrong. But like when you do the meditation, you get the proper sleep, clear out the head. You're like, she
not as
says
reactive.
something, you take a few seconds to just make it make sense to you, and like you like answer almost immediately, and it makes sense, and it like makes them feel like you're there, where like
present.
when you don't have that clear mind and you're not, you're not expressing
Not
yourself the way you should
necessarily.
be. I think
Okay.
One of the worst things is in an argument with your wife, if you're wrong, the only
Which is
thing,
always,
the,
but go
the
ahead,
only
keep
thing
it.
the only thing worse than that is if your wife is wrong.
Yeah. Well, that's right.
You
That's
have
right.
a right. You have a wife who's wrong. Wait.
Yeah.
I don't think
You
you're
haven't
allowed to say
experienced that,
that.
haven't you? Yes,
You're
experienced
gonna
that.
have them cut that out.
If
Here-
she's wrong,
I
then
think-
it's
But I
just
will
like
say you are right. You're right about that. With,
Some of the
with
best
meditation.
medicines of
And for me, it's
sleep
creative.
meditation.
Like if I don't
Yeah.
get behind a keyboard every day
Yeah.
and I'm not creative, then I'm a lot more, able to have a knee-jerk reaction to something that she would say to me or someone else. But if I give myself that time to do that, I find that I can manage my energy more effectively.
Yeah.
And ultimately, that's what it is. I mean, it's energetic management. You don't want to be spending your energy, and getting into a fight for no reason.
Yeah.
And I find I get a lot more moody too. If I don't work out, I do like quick
Of course,
resistance
that's all,
band
yeah.
workouts, and
20
like I'm
minutes.
like I
Yes.
just need to do that. I'm
Yeah.
like
Yeah.
I'm like I haven't done it for 3 days. I need to get on there because like
As a
it's affecting me
musician,
a lot.
I just curious thing. Have you ever played shitty music on purpose?
Not on purpose, but I mean, I have. I mean, I
Maybe
went through a
when the
stage.
high school- I
I
mean,
went through a
college
stage of
stage.
songwriting, and like I thought I could write in any genre, right?
Yeah.
And I remember literally thinking I wrote the best country song that was ever written.
don't even
And to this
like
day,
country
my friends will still tease me about that one song.
Yeah.
It was called Champagne and Roses. It was really bad.
Was it?
Yeah, it was really bad. And I wrote a couple punk rock songs that I thought were great.
But I don't know, you've said this yet. I mean, I'll say it for him because he doesn't do it enough. He won a Grammy for producing Les Paul, the inventor of the electric guitar.
There you go.
Nice.
But
And for best rock instrumental.
Yeah.
But now he's known for this healing music and the medicine, your book, and all the studies behind it, limbic deactivation, all the science behind
But I think you
music and medicine.
I mean, I think everyone
cool.
here is probably in the same area where you have to practice a certain amount and make mistakes, right? To get to the level
You're gonna be
where you
okay to
can
make
go on
mistakes.
autopilot, where you can mental rehearse.
Yeah.
Think about like Curry or Jordan, right? They would say they went through mental rehearsal.
Oh yeah.
Every shot, Curry would shoot how many shots to get to that place of mastery where they cannot think about it.
Yeah.
So you have to make those mistakes
Yeah.
to know what you don't want to do,
Yeah.
right? And also to become more expertise out in your lane.
Yeah.
And
It's
I had to
you
find
just-
my
you
lane
just
like
keep
you do.
learning from, and that adds onto it layer by layer with your experience.
That's it. And you got to say, okay, well, I guess country's not my lane. Punk's not my lane. I definitely didn't think music for sleep was going to be my lane.
Yeah.
Yeah.
And I think that's the other part.
meditation, you're big
Sometimes you
things,
have to pivot and you diversify into other areas that suddenly, change when you change your whole life. There's a fork in the road.
Yeah.
Yeah.
And you decide, oh man, I think I'm going to go this way. And that was like right after the Grammy.
You're just like, I'm really good at this. I'm
Right.
really good at this, and this is helping
Rock
a ton
instrumental,
of people out.
Right.
Is like I gotta go full ass into this
That's
shit.
how I got into the whole anti-aging thing too. Like I was a fat mess. Like after we had our first kid, I ate all the crap my wife ate. Like when she wanted to order out, so I gained a ton of weight. And but when I got time down, I'd just be on my phone, reading different articles about health and wellness and stuff. And I'd always been interested. I've always been in the health and wellness industry. But all of a sudden, with peptides and everything, I was like, all right, let's try this, and started trying stuff at home myself. And I was like, oh, this feels great. And then I started talking to my nurse practitioner about it. She it got her fired up right away. And then me and her would have conversations, and really we both started to master it. And we're we got to take this to our patients now, and it's helped so many patients. It's you just try different things because, surgery, I did thousands of surgeries. Like the first 5 years, I don't think I really took time off, and I was operating like crazy. So you kind of burn yourself out, but like this brought like new joy
Life
and love
back
into
in it.
medicine.
Yeah.
And you know, and then picked up more on the aesthetic stuff, and like where I'm able to help out people, because one of the main things was like doing, you know, patients would come in and like, I see all these people like doing surgeries on patients with BMIs like 40, 50, and I didn't even get that high.
Right.
But I was like, all right, am I doing these people any good? I'm making fat a little less fat, and it just does not feel right to me. You know, like we got to help them out in other ways before
Or
we
you do
get
a
them.
surgery and then regret, like being like, I
Right.
shouldn't have done that. Like,
Yeah.
But you were trying in the moment, thinking, I'm helping. And then,
this is the best option.
Then you
for
go,
the
that's
patient.
right. And then you look and say, okay, let me get to the root cause, but that takes time.
Yeah.
Yeah.
It's time to get to that root cause.
Yeah.
Yeah, and I mean that's what I'm always like hearing people say from the other room, not just patients, but everyone that she worked with. You asked, oh, no one's ever asked me that question before. That's a great question.
Yeah.
And I think that's what drives you as well, is just you ask great questions, and that helps get to.
Yeah, it's seriously with like what she does. It's like it's incredible. It is seriously like taking that extra few minutes that we're not just trying to plug holes.
Right.
You know, we're physicians here to fix you as a whole instead of just plug holes. And that's what you don't get in medicine these days. You want insurance to cover your stuff. You're going to go in there and they're going to patch this up so it leads to the next thing. So it leads to the next thing. They're writing you 4 different medications for the same thing, which they could have resolved the first day.
Yep.
So
It's not a cure.
No,
exactly.
not a cure. It's
a
symptom management. And, you know,
then
hoping
we
the body will
ordered
get
this
better.
guy to come play keyboard for him.
There you go. That's it.
That's like
I don't do house calls, man.
He doesn't do house calls anymore.
It's just like, I know you don't like your results. I got a guy.
Wish it was that easy, don't you?
I wish it was that easy.
Yeah,
That would
that's
be so
amazing.
great.
But the other interesting thing I found, like you do a course at ASU, or do you still do the course?
I did. So for 18 years, I developed it. I wrote it and developed it, and I stopped during the pandemic because certain mandates, and I said I have a voice of my own, and so for 18 years, and it was ancient healings for modern times, and it had to be a master's level, so it was mostly doctors and nurses or social work, people that wanted to know more about homeopathy, naturopathy, Ayurvedic medicine. What are all these things you hear about?
Ayurvedic medicine.
Ayurvedic is older than traditional Chinese medicine. So it's a way you'd look at your dosha, kind of like your constitution, and it's just the way you should eat, the types of foods, all those things. It's like Chinese medicine. It was actually older and predated, and there's still a lot of. It's interesting. A lot. That's what Deepak Chopra's. I went to his training in Ayurvedic many years ago, Ayurvedic medicine, and I think they still do that.
Yeah, they're still
not
doing
sure. It's just an ancient way of looking at the body holistically. As we started this conversation, right? Holistically, look at the whole body, your personality, how you were born, all those things, and there are things that that you look at and you go, okay, I can see that you're this dosha, which means this type.
Have you thought about doing that as like, as a online learning class at all?
They wanted me to. So here's what I'm doing. I've got a podcast about to pop with Les Brown.
Sweet.
You know who Les Brown is, right? The motivational Les and I, because he's my patient. He has cancer. Well, actually, no evidence now.
Yeah.
But because he would in the middle of the night be texting me from Atlanta going, here's an influencer. They just said this. What about this for my cancer? I'd say, no, not yet. We don't know enough. So and I have a television show. It's a debate format between conventional and alternative. We've never done it in medicine. We do it in politics all day long. We have never heard both sides together.
But the conventional is going to get crushed.
Well, that's the problem. That's why it couldn't be on a typical station, kind of and not. But so when we did the pilot at PBS, I had 2 board-certified cardiologists, right? Traditionally.
Yeah.
One was Stephen Sinatra. I don't know if you guys knew who that was, but in the holistic world.
Frank's brother.
Yeah. He showed up long hair, like a tie-dyed shirt, and then on the other side, Dr. Thames, both board certified, and he's in a bow tie, his pants are too short, and he's showing his white socks. I couldn't have dressed him more perfectly. So it was like, so at the beginning, very nice, as we do as physicians, let's talk, and then by the end, one was saying, you sound like the tobacco industry 20 years ago, and the other one's going, and your story's pie in the sky because you don't have any science behind it. So and my job was to bring it back into the middle, moderate, but also hold both to their strengths and weaknesses. Yeah. One was saying, go do CoQ10, and I said, that's great, but what about the quality? Are you talking about that?
Yeah.
What are they putting in their body? So my job, because I'm licensed in both, was to be able to do that. So to answer your question, I got bigger things along that, but it's a nice course because people want to learn about those ancient traditions.
No, I think it's, I think a lot of them circle back, and we've talked about it because we're Persian, and like a lot of the old Persian, like our parents eat pomegranate,
that's right,
barberries,
berberine, which is all coming back.
Cherry juice,
that's right.
All that
for gout, all that.
Best exercise. Mom was like,
Mom's
you
chicken
want to live
soup.
Forever, you got to do jumping jacks. Like,
that's
why
right.
do you do jumping jacks?
But Mom's chicken soup. Now we know why.
Oh yeah.
It's the tryptophan. Now we know why those things. But they knew over centuries. Of course, they know what was working.
Just work.
That was part of my UN talk.
Yeah.
Was like, these botanicals. 80% of our meds have come from botanicals.
Yeah.
We've only identified at most 30% of what the world has in medicines for us.
Yeah.
We haven't even begun to look at those plant medicines. So all those ancient healing traditions, we have a lot. And I say, let's go to some of those countries and say, what are you still using? Okay, this is what you use for this. Let's study it. Let's have a business for them to help their local people and do, somebody needs to do that.
So anytime I get like a slight congestion or cough, I just go eat whatever grass and plants are in my backyard. Cures everything.
I don't want to ask what's in your
After
glyphosate.
After they just sprayed Roundup on it.
Honestly,
he makes sure it's a golf course. So extra glyphosate.
One of the most toxic places on the planet.
Dead serious.
Of course, my dad's up there.
Like, knock on wood, I have just not gotten that sick. I got sick like once in the last 6 years. Yeah. Where like I got the flu and I was like, I can't do shit for like 3 days. But that's
a good immune system. You're kicking it within 3 days. You studied immunology.
He doesn't travel a lot either. He's got to travel across country a few times.
I'm the dirtiest motherfucker to ever live.
You got the microbiome.
Like, shower less. Use less soap. Like eat dirt. Like just do the nastiest
the whole
things
microbiome thing. There's truth in that.
Tells you not to do. Like, go for it.
That's right. You know the hygiene theory with kids.
Yeah.
Right? If you let them, they drop the pacifier, you're not supposed to go sterilize it. You're supposed to have them introduce microbiome. They are healthier. So we kept them too sterile and clean.
I totally agree with that.
No, that doesn't count. You still have to do your dishes.
They say even the bottles, you're not like people
reusing dishes with crusty lasagna.
Now that's bacteria growth. We got to just say that's a little much.
You can still do that. That still goes along the lines of what you're arguing.
Well, if you're going to do that,
that might be carcinogenic because it's burnt.
Well, there you go. You have to look at what is it.
Don't overcook food that you don't properly.
Well, you can have a histamine. People have histamine responses from leftovers. It's individual. We're back again. Yeah. Maybe your body's used to the bugs.
That's the thing. Like arguing, like throughout COVID, and like again, did a ton of research in an immunology lab prior to residency, and it's like. There's a balance. Like your immune system as a human being is reliant more on memory than it is on how it fires off. So like when you're young, your thymus is big. You can have a big response to like a big infection, and gradually over time, like when you're like 28 years old, your thymus is non-existent. Even on imaging. But what shifts in your body from like these, like not just natural killer cells, but like your innate immunity to attack these shifts more towards memory cells. T memory cells, all these memory cells. So your body builds an immune response. So like you're not teaching your system to develop that. That's a big like decline in like what you can fight off.
That's right.
When you get older. So when you get older, the way to think of it is your immune system needs to be more efficient.
Right.
It's not going
as
to be
robust.
as efficient.
Yep.
It just needs to adapt more to it.
More adaptogenic,
So
yeah.
I don't know
Where are you going with that?
No, but it's that's true. And then we talk about the
You don't,
microbiome. I
you
heard
don't
you
have
guys
the
saying
energy to have the same response to
That's right.
to an infection.
Well, we're back to mitochondria
So
too, ATP.
You need your
You need it.
innate, you need your innate system to be able to respond to that.
That's
stuff.
why you need
You know what helps hyperbaric oxygen?
Yep.
That's
All of
those
it.
things. All
NAD
that.
with your hyperbaric oxygen.
I'm not 100% on
No,
NAD yet.
Yeah,
I'm not
I'm like
from
I'm
the
so,
cancer
I
standpoint.
I like NAD just because it makes me feel better.
Sure, it does, but so could cocaine and some other things. I'm not.
That's
But
why
all
I'm a
I'm
big fan
saying
of
is,
cocaine too.
so
I was gonna say,
well,
You might not
I didn't do. No, I've
Don't
never
try
tried
to
anything.
express
I'm like
the
the person
point.
here that maybe is the one that's never tried
You might as well
anything.
have a beer to wash it down.
Yeah, okay,
right?
yeah.
like
I'm
that.
just, there's a
my
little
nose.
signal that we're a little concerned.
Yeah.
I'm kidding, audience.
Because, you know, if
jokes
you read,
aside.
Sinclair's book,
Yeah.
I said, did anybody read the last chapter? That we don't know enough yet
Yeah.
to be careful with cancer. That's all I would say.
Yeah.
We would never, and so I was trying to get a C of A and get the things that I make.
Yeah.
All my companies do that I
Yeah.
utilize to give me the testing. And it was the biggest, and well, I'll just say,
one- the
NAD
one thing
company. I said, give me this analysis. And they go, no. And I said, what do you tell people who have cancer? Oh, no, you can never
So I'll
do
tell
that.
you
So
one
we
thing:
all have cancer
whatever
cells.
you fuel your body with can
Yep.
fuel a cancer cell.
Of course. Well, sugar is the number one of the main
yeah.
things. And that stress does that too.
Yeah, but
Some
there's like
psychosis.
pretty much everything you consume that gives you energy will, in one like pathway or another, fuel cancer cells. So you can argue that point to
I don't know.
not
I'd
consume.
have to
I don't.
fact
I
check
would
that.
I would counteract that. I
But
would.
it's like it's got to be like
Yeah.
no, it's
Right.
they're cells. Cancer cells are cells.
Right.
Your body is cells.
But
They're
there's
living
certain
off of-
energy stuff that's going to be more antioxidant.
Cancer
That
can
is-
only
that is
use glucose.
true.
It can't use ketones.
Yeah.
Normal cells can and help fight. So there's different fuels for the different types, right? Do you agree with that? That cancer uses
kind
different
of,
fuels?
kind
So
of,
read Dr. Tom
kind of.
Seyfried. I want you to start following. I want you to see Seyfried.
Kind of.
Okay.
But like, there's a lot of arguments for like what you can. Again, what fuels cells is also going to be the same thing that fuels cancer cells.
I would maybe
I'm
disagree.
just saying, like even stem cells, like wrote a couple of chapters on this mesenchymal stem cells.
Right.
It's great use cases, but if you can't make sure they go along a certain
100%
line,
agree with
they
you
can
there.
go along another line.
100% agree.
But
We
the
got to be careful with that.
The
Cancer.
fuel, I don't think we're anywhere close to figuring out the fuel. There's certain things that definitely aggravate and lead one way or another. Like if you're hyperestrogen, like a lot of fats, and your body's turning a lot of those fats to estrogen, and that's constantly like berating your cells. But it's not very discreet.
So I want you guys to get Dr. Tom Seyfried. I'll ask him to do a podcast with you out of Boston College. He's written the book Mitochondrial Health for cancer, the mitochondrial disease of the Krebs. So we know there's two pathways that feed cancer, only two. Only two. So I want you to, we won't spend too much time on this, but right now we think we're pretty clear on that piece. That's why stress and glucose need to be reduced in cancer patients, because that's the fuel. When it doesn't have that and only has ketones, cancer cannot use ketones as fuel. But your brain can, which it loves it, body does. That's why we put them in a ketogenic diet. So it would be a fascinating conversation. I'd love
I
it
would love
because
to talk to him. I actually disagree with that. I personally think it's you give it fuel, it
But if it doesn't know how to process it,
that's it. It can't utilize it. So it's a
that's a whole problem with NAD itself, right?
That's right.
Because and we're coming up with NMN, nicotinamide riboside, because they can't get it into the cell. Right. You can take it whatever way you want, but it's not getting into the cell.
So we have done quite a bit. Dominic D'Agostino and Dr. Tom Seafried. And then we've got our international group from Cambridge to everybody. The science that's coming out, it's fascinating. I think it's worth another look. I'd love to hear the conversation. I'd love to hear the conversation. But I would say that I'm on so far in what I've seen with the cancer patients that I work with worldwide, is that when we're utilizing these therapies that block those two pathways, that's when the oncologists are going, okay, whatever you guys are doing, this is great. Yeah. This is good. So, yeah, it'd be another conversation, right?
Yeah, definitely.
It'd be fun. That's what we're supposed to do.
Yeah.
In medicine and in science.
Exactly.
Yeah, and that's why we do this podcast.
I know. We found a bunch of stuff.
Just watch his YouTube. You look at Tom Seafried, and I think you'll find it fascinating. He's got some good hard science. Good hard science on this.
Cool.
And then the other thing that you need to do a podcast on is the difference between male and female brains, convergent and divergent thinking. And how there's different parts of the brain.
I can't understand female brains.
That's my point.
I can't even understand what she's saying right now.
We'd probably be lost.
That's because
like this.
You guys can only use one side of your brain at once.
I'm trying to tap
into the other side. Never can turn it off. It's always tapping in both sides. You guys can only do one at once, and that's good. It's all good and bad, you know, in different ways. But it's fascinating.
Wait a second, though, but music uses both sides of the brain.
Yeah, but not at
men
once.
And female.
No,
not the right parts.
Not at once.
Not at once. You guys
That's why
never
I can't
cross
vacuum
over
the floor
and
because
talk.
I'm busy using this side of the brain. Vacuuming is on the other side of the brain, so I'm gonna have to ask you to vacuum because you're so multifactorial.
Now you're really gonna ruin it for me. You told her you vacuumed.
Now you're in trouble.
Vacuum. I'm saying I don't.
You can see it in utero. You can tell if it's a male or female fetus by the brain. By the brain.
By the brain?
By the brain structures. We have a larger, more active, intuitive. No. Well, men can never vacuum.
No.
I know.
I can. It's not going to be
I don't want
good.
to. I know.
You don't want it.
That's because you don't want it to be good. Yeah, that's right.
If it's good, though, you'll get asked the next time. Just be a little dirty.
You know what?
That's right.
You know what?
Really important
stuff. I can do? I can afford a Roomba.
Yeah.
And,
just get in the
Roomba fucking sucks, but it does an okay job. It definitely does a way better job.
I think we bought 4 and we threw them all out.
But just saying a female might be able to turn on the Roomba and take care of this and this and this and this and do 10 things at once.
Oh, the female will
just multitask, be able to. It's just our brains are made differently. It's not one's better. I say we teach that in corporate is that, you've got a team, you've got male and females, and it used to be that everybody would say, we got to have a quota, we need more females at the C levels. So they hired them in, and then everybody started quitting, and they said, it's work-life balance.
I'd like to argue against you, but he's giving me that look.
Oh, yeah, okay, time. But it's another show, I'm telling you,
Even if you're right, you're fucking me over, man. Do not prove to her I could do any more than I have so far.
I don't want to vacuum at all.
Yeah.
No. I can't vacuum.
That's right.
I got one channel, man. I'm just like.
He's like, no, I'm in the middle of composition. I can't be. No, that's why we have somebody clean. So that's why we have somebody to
We do too.
Yeah.
But we need to clean for the cleaner.
Well, that
so do we.
too. He goes, why do we
new.
have to clean? And I said, you have to pick up and straighten up so they can.
That was a whole new
thing.
He doesn't know.
Cleaning for the cleaner.
But you do.
You don't.
I know. How about when you're at a hotel? I'm like, she's like, they're gonna think we're dirty. I'm like, who the fuck cares?
It's not that. I'm saying you gotta put stuff up or they can't clean.
These are the downsides.
Your house is different, but when you're at a hotel, my wife's like trying to tidy up the place. I'm like, shit.
Now that I don't do, but that's okay. But God bless her for doing it.
These are the downsides of having both sides of your brain firing at the same time.
Yeah.
They're battling against each other. It doesn't make sense.
No, it is.
Like, we need to clean. The cleaner's coming. It's like, no, you don't. The cleaner is coming to clean.
It's convergent, divergent. The best example I've got.
I have to agree with
you. If there's a bear about to come in here and attack us,
Yeah, I want to
Then
make
a
sure
female-
my kitchen is fucking
Yeah, well,
sparkling
a female
clean.
would be
I don't want to
saying-
be murdered
That's
by a
That's right.
grizzly bear.
That's right.
And there's
That's right.
dirty dishes
That
in my
you
sink.
got it.
And it's
That's
not just
convergent
cleaning the
divergent
house.
thinking. A woman, if that bear gets killed, do they have what would it happen in the room? Do they have babies? You women always think about the consequences
Like,
of
the
every
bear's gonna
decision.
attack you. I'm like,
Men go
is it
shoot,
really gonna attack?
boom, and it's that way in corporate too. You got to make a
guess we'll
decision
fucking-
sometimes.
Well,
boom.
and in creative too. Like my
should I kick him in
my
the
studio
nuts?
can have things all over the place, right?
Search for them.
In order for her to be
I gotta teach
creative,
you
the house has to be clean. Everything's got to be in the right place. I can have cartons of Chinese food all around me and still be able to
Yeah,
create.
Oh yeah. Oh yeah.
Doesn't bother
you
him a
You know,
bit.
I'm in a zone,
into
and she
that,
can't
like,
get
He
into the
doesn't see it.
zone unless
Yeah.
things. So we all have our different.
Yeah, but
creative
that's
styles.
that's true. But male and female brains
But
are different
that's
in a
totally
different way.
male female because my wife's like, I gotta have this spotless. Like
Right.
I'm like, well, just do your work. This is gonna take more time.
I
to
can't
do both.
focus on my work.
Right, exactly.
I don't have enough time for this, but I'm gonna go clean the whole house.
Clean it up. It's
Gonna
like,
have to
oh,
do
I
it.
I can't focus
Yeah,
on
yeah.
this. I was like, what else can I do? Let me polish your iPad
Very
screen.
different. Yeah.
Whatever.
Good
yeah,
answer.
Yeah.
That's a good answer.
Whatever
Yeah,
it
that's
takes.
right. That's right. Yeah.
So outside this, I was gonna ask you a question. So my,
Okay.
Outside of that,
so you know a lot
Have
about
fun
like
editing.
lasers, red light. So what's a good one? Because like my shoulder from all the liposuction, it is like, you know,
Having an issue. And
issues.
yeah.
And I used to do heavy
that's why
body.
he always
So I-
flexes on the right side.
I used to do heavy weightlifting,
Yeah.
like competition bench pressing, which totally ruined my shoulders.
Yeah,
throughout
of
the
course.
young-
I used to compete in powerlifting myself.
Yeah.
Did you?
And I didn't mean to. It was just they saw what I was doing at the gym. They said, you're breaking a world record. And I said,
Yeah, I was.
so I
yeah,
want
I
to
was
state that's
similar-
kind of the
yeah.
same thing. I wasn't a power lifter
Yeah.
at all, but it was.
Yeah.
Anyway, so there are some good companies that are very, very expensive.
Yeah.
And I used to do studies for some and all that, so I hesitate to name. But what I would say, a red light laser, not
You're
LED.
off camera, you can tell me
Red
whatever.
light laser. Yeah, but they're.
Yeah.
I think they're too much money for what they are. As long as you get a 635 nanometer, you don't need
Yeah.
the 880. You don't need the higher
Yeah.
levels. That's not as good in the studies
Yeah.
out of Russia. So a 635 nanometer good red light laser that has
Yeah.
a good warranty. That's it.
Okay.
So
Yeah,
there's
because
quite
I
a few
looked
out
at
there
that
now.
Kineon or whatever it is. It
Yeah.
keeps on coming up, and I was
Yeah,
like,
I don't know. I haven't looked into them. So.
and then there was like,
He's
and
probably
then I was
bought,
gonna
like,
just
6 of
use.
the stuff that
I was going to use Hyper Ice, the heat and compression, but I was like,
I don't know that that's going to do much for
I
what you're
was
talking
like,
about.
it's not going to do much. Yeah,
and I'm
for
not
more
sure.
chronic
Laser.
stuff.
I mean, so you don't have any tears. You don't need surgery
I
at
pr-
all. Is it what's going on?
I would stay away from shoulder
More
surgery.
degenerate. Yeah, more
Yeah, it's just-
degeneration.
Yeah.
So
tried
hyaluronic acid,
therapy?
growth hormone injection into that is pretty
Yeah.
pretty significant.
Yeah.
Can help, even though it's
Phototherapy
off
would
label,
help.
but
Yeah.
PT might help. Yeah.
Well,
Can
it's
or
not
not.
that. It's just it gets really sore at night.
Your range of motion
Like,
is okay.
range of motion
Well,
and
that's just
stuff's fine.
inflammation.
It's just inflammation. That's what I'm just trying
That's
to calm
just
down.
inflammation.
Yeah.
So then the red
People-
light would help
Yeah.
you with that.
people
Yeah.
negate
But you say
physical
red light
therapy
laser
because you have
over-
full-
Yeah, lasers. Yeah,
The LED?
LED's a baby version of laser.
Okay.
You want better effect. It's a cold laser. It's a low level laser. It's
Yeah.
actual laser.
Yeah, a
frequency.
chiropractor friend of mine actually gave me one and then took it back. He had cold laser. He was like, "Oh, this is a FDA approved to do carpal tunnel without
That's
doing a
probably
carpal tunnel."
one of the ones. So the company that's done all the studies that
Yeah.
everybody knocks off is the one that I was working with. So,
Yeah.
and they're good, but you don't have to pay that kind of money.
Yeah.
So,
Okay.
yeah.
All right.
How about trying physical therapy? For a longer
If
period
it's
of
wear
time?
and tear though, and they're
It's
just
not-
doing it,
it's
can
not- it's not
if
like
it's
Just fuck
osteoarthritis,
physical
it can make it
therapy.
a
worse.
lot of people.
That's what I'm
say,
asking.
Well,
"My-
his
my
wife's
wife
a
is
physical therapist.
Yeah.
And he thinks I can make time for it, which I don't have.
It's not about making time
Like
for it,
making
but
time
like
for
if you
sessions.
negate like what your body needs,
That's right.
and you want to just consume
That's right.
something or shine
Yeah.
a light on it,
Yeah.
you're fucked.
It
Either
could
way,
help,
your
but I would
shoulder's
also what you're
fucked.
saying too, prolotherapy.
Yeah.
And your PRP
Yeah,
with an
that's-
expert
that's what
injector
I-
that
yeah.
knows in that ligament attachment.
Yeah.
Right there at that spot. That
No,
might
yeah.
be. I don't know what's going on,
Proper
but
Yeah.
stretching and exercise.
Well, that,
will
all of it,
probably be even
it might
better
be.
than
I
that.
do the
Or
stretching
even,
exercises.
Or even
Just don't
improve
listen to it.
PRP exosomes, all
Yeah.
those things too. That's
exosomes
what
are
I'm
yeah.
saying.
I will tell you what, we were teaching prolotherapy, and then we started PRP. I think I was the first one in Arizona doing PRP. And I just didn't see any better results than just doing prolo. If you get the right injection, the right needle in the right spot, it's prolotherapy. It's just dextrose.
Yeah.
And it's about where the needle is, where it's placed, and creating that inflammation in that insertion. I found it was still better. In fact, a lot of us did. Those of us that had been doing a bunch of it, it's just less expensive.
It's gotten better. I've been injecting BPC into it.
Okay.
It's gotten better. But
it's
like,
more about where the needle is, I think, than what you're putting in there. I do. To your point, is somewhat PT and mechanical things.
Like, it's just...
Now, if you're not going to make... I personally, deep down, even with all the holistic aspect, best thing is PT. If you're not going to make the time for PT, then you have to look towards other aspects. If you're not going to like actually treat the root cause problem and treat
But I don't have to go somewhere to do PT. I can do it at home.
Yeah, you got a PT to put you on a program, and then if you just do it, right? But sometimes it depends how much degeneration. A good PT is worth their weight in gold. I'll say that. A bad one, or a person that's not going to do it right or not going to do it, it's not going to do anything. So I don't know.
And if you
I
don't
like the
believe
needle
in
better.
it, then it's not going to do it.
It's just making the time for it, and I don't have time for it.
All right,
Yeah.
well.